to talk about the waste utilities, impacts and responses, keying off of Christopher, who talked about the water utilities, and most water utilities in the Caribbean also responsible for wastewater. But we're going to take a look a little bit at the solid waste here. Let me start my timer, right? So, who's the CWWA? Caribbean Water and Wastewater Association. There, and y'all will get the presentation after to be able to read this in detail, but we consider ourselves the preeminent association of professionals, practitioners for the water and waste sectors in the Caribbean. Over the last few years, we have taken aboard the waste practitioners. So we actually, we have been incorporated by an act of parliament since 1991 in Trinidad and Tobago. We're looking to change our name to the Caribbean Water and Waste Association, but because it was a incorporation by an act of parliament, it's a little bit more of a drawn-out process. But by all intents and purposes, we consider us the Caribbean Water and Waste Association. Our vision is to advance the science and practice of water supply, wastewater, and solid waste management, and to promote the efficient management utilities. Our membership, CAWASA's membership, is a membership of the utilities. Our membership of the people. And that's the main difference between CAWASA and CWWA. So we work together in the region to promote the water, wastewater, and waste sectors. Let me get right into it. I'll talk about CWWA after. Waste management, an essential service. Well, I'm not going to read everything here because I know you guys can read, but the underlying thing, like what Chris said, is that the show must go on. Waste has to be collected. Waste has to be properly treated, if it is, and disposed of properly. There's more demand for improved health and safety practices and procedures. Now, what's interesting with both wastewater and solid waste is that they're always infectious waste anyway in our environment. COVID-19 isn't the only one that is there. So sometimes what COVID-19 has done has been able to heighten our awareness of it. But a wastewater worker and a solid waste management worker have to be careful anyway, as we will see in a little bit. Pre-COVID, the utilities were stressed. You know, there's lack of money, there's HR issues. The government perhaps may not make it a priority, but just because of the calls they're going to get from private industry or politically what they need to do. But we have to be prepared and we have to respond. One of the things we talked about here, COVID-19 is a disaster, is an emergency, but as Chris alluded to, in the Caribbean, we have environmental emergencies, which look almost the same in certain ways. For example, you may have a worker that has contracted COVID-19 and cannot get to work, or his office is closed because there's a problem with the virus there. So he cannot get to work, let's say. Well, what's the difference with him not being able to come to work because of COVID-19, or if a hurricane hits and trees fall and block the road, he still can't get to work. So the office that he reports to sees the same thing, sees a worker that cannot get to work. Of course, there's some differences with a disease versus a natural disaster, but still, the water utility, the wastewater utility, the solid waste management utility will have to treat many of these emergencies the same way. And climate change is a big thing in the islands as well. Improvement of operational efficiencies is important. We need to train, we need technology. You heard Stuart talk about that. We need training, we need technology. Everything is not the same, and of course the workers must be protected. So look at some of the impact on the contractors. We'll start there. Garbage must be collected. Now in the countries, in the islands that we have, there's some islands that utilize private contractors to collect their waste. And most of the islands, it's the government agencies that collect it. But be that as it may, they have to go out there. And if you're a contractor, there's more demand for domestic waste collection as folks are staying home. As Chris said, you're staying home, you're eating more, as the big complaint, and you're using more water in his category. For waste collection, there's more garbage, there's more waste to be thrown out. However, so there's more waste, so therefore you could imagine if the truck is driving along and there's more waste, the trucks will get fuller quicker and may have to make more than one run in order to reach the end of the route. And so that's a challenge because they're being paid the same amount for the most part. Waste collectors are paid the same amount to collect waste whether the trucks get fuller quicker or not. And of course, the part supplies are closed. There's always employee challenges, some because of sickness. We talked about riding in the truck before. Maybe 3 guys could ride in a truck, and now they'd have to just reduce it to 2, or maybe somebody has to stay on the back of the truck longer than they should, hanging off the back, as we would say. So there are challenges. Of course, with COVID, as Chris talked about in the islands, less revenues from decreased rate payments. I was happy to see folks lining up in Grenada to pay their water rates. Not sure they're going to do that for waste rates. Of course, the biggest thing in the island, most islands, is no tourism income. I mean, no tourism income means hotels are closed. And now with the stay at home, the restaurants are closed. So for some of the waste haulers, there will be less waste because the hotels and the restaurants are not open. But the government is also collecting less money. And in collecting less money, they will have decreased national revenues. And of course, if they decrease national revenues, they have to put it in the more priority areas. And that isn't always to finance these sectors. Improvement of operation efficiencies becomes more paramount. We heard that a couple of times this morning. Most utility personnel at home, you have to stay at home. Protection of workers is critical. And major projects that were deemed non-essential, in fact, most major projects right now are on hold. So there are no revenue. So contractors may have been given a contract in order to do something, and now everything is put on hold, and that perhaps is the income they were looking for. And not only that, they may not be able to continue paying their workers, so they have to lay them off. And sometimes, and contractors do not like to do that because sometimes when you lay off somebody, they go and work for your competitor. Or when work starts back, they're not available for different reasons. Financial aspects, just like water and wastewater, the hotels are closed. There are no collections, but there are no revenues either. Same for the restaurants. Residential waste, increased volume with stay-at-home measures, but the revenues are the same because you're just getting paid to clear a route on different days. You don't get paid more when there's more garbage. Bill payments have decreased. Of course, we talked about the commercial offices being closed, less cash payments. There are people that like to pay cash. And as Chris said, I didn't even realize that many people want that receipt. It is in their hand. It is proof that they've paid. And they have a lot of folks, many of our pensioners, I know here in Trinidad there was a discussion, the pensioners get their pension check and they cash it, and then they come with the cash to make the payment. So they're not necessarily looking to pay online. And the less payments from the elderly, that doesn't mean anything other than most of them like to pay cash and get a receipt. And then of course, those who are non-computer savvy would rather just go to the office, make the payment and get the receipt and go. Now, many of these sites, many of the utilities are looking at improving ways of making that process easier, which we'll look into that. Subventions, another impact, of course, subventions from the government has decreased. Increased health and safety costs, as Chris mentioned, masks, hand sanitizer, and a lot of these things may have been purchased under emergency mode, which tends to make the pricing a little hot. Waste management challenges, residential waste. Now here's an interesting challenge. Yeah? The more waste is generated by a stay at home, great. But you may have somebody sick at home and you don't know. Either it is in the early stages or they may be non-symptomatic. So you have the garbage men, the waste management personnel, picking up waste from homes that may be infectious. Now, what's interesting, as I mentioned before, is that COVID-19 isn't the only infectious waste that people have at home. So generally speaking, waste haulers should be careful anyway in collecting the waste. The challenge in one of the challenges is to be able to separate the waste. So if you have somebody that has been tested positively for an infectious waste in your home, be it COVID or any of the other infectious ones, there is no separate collection by the haulers for that. You know, we were in a Caribbean forum a couple of weeks ago, and they were talking that, you know, we should put it out in a separate bag and it should be collected separately. Nobody has the infrastructure to be able to do that. So what we have is that we have residential waste that may be infectious being disposed in the general areas of the landfill with the other waste because it's not identified. And the waste pickers of people, you know, individual entrepreneurs that will go through people's garbage as it comes into the landfill and separate it out for recycling, for reuse, to repurpose. And I know in Trinidad, you know, as you're driving in, it's kind of dramatic as they're driving in. They jump in the back of your truck and start pulling stuff out and throwing it so that they can get it first before anybody else. But that's a problem if some of that waste is infectious. Medical waste, a little easier to handle because it is assumed that hospitals and the quarantine locations have infectious waste. So that waste is collected separately in just about every island. Now, one of the challenges is that there are more infectious patients, so there are larger volumes for special disposal. So one of the items, if you don't have an autoclave, and some people still have incinerators, not great for the environment, but it is what it is to just make a separate control cell, dig a hole elsewhere, and bury that waste separately. And of course, in the best strategy is, of course, to fence it so that nobody can wander in there and take something out from there. One of the challenges that was raised by our people was that sometimes private hospitals and doctors' offices do not have special collection and disposal procedures. And that's the thing. You go to see a private doctor, you may be asymptomatic, or maybe not. Maybe you've started getting something, and whatever you use, you put into his trash, and his trash goes into the trash of the doctor's office, and it's infectious, but it's not identified. So that's one of the challenges they have. Health and safety, always. Safety procedures sometimes are inadequate, or they may be in place, but just over time, people get lackadaisical about it. So training needs to continue. Residential waste, some of the responses. Well, bury it immediately. Consider it all infectious if you're taking it from homes. Just handle it carefully. COVID has heightened the safe collection disposal practices. Recycling and reuse has decreased to zero in some islands, just to keep it simple, because they're working possibly with less people. And maybe if the equipment is starting to break down and they can't repair it, they have less trucks. So they're just keeping it simple. Let's just get the garbage, let's get the trash, let's get the waste to the landfill and get it and bury it every day. No collection of bulky waste in some islands. That's complicating things. Keep your old washing machines, keep your old chairs. You know, we're just disposing of regular waste that needs to go. Medical waste handled separately where possible. Public hospitals, they already have arrangements in place. They probably have their own contractor, separate trucks, separate location for taking their waste. Some hospitals have their own autoclave and their own incinerator as well. Quarantine locations, of course, new arrangements would be made. There's some, you go to a fresh building that can hold a lot of beds, like you've seen in the news all over the world. And so the waste coming from there is looked at to be infectious. Private hospitals and doctors' offices, of course, you have to communicate the importance of separating their waste for disposal. And of course, we're talking about a separate controlled cell for burying if no autoclave or incinerator are available. Health and safety of workers. Many places have reduced staff on site, reduced office personnel. Some work remotely. The elderly and those that are at risk and non-essential workers, they're not necessarily the same. They're sent home. You don't want to keep the elderly there because they're high risk. And if you're trimming back down, if you're trimming operations, the non-essential workers sent home. Contract staff actually may be cut from the payroll or furloughed if it gets really bad. You have to ensure adequate PPE for workers while they're on the job, because they do have to come to work. Social distancing is in effect. Special training is and where required. Workers coming in will be screened daily for symptoms, sent home if there's any doubt. Waste pickers are not allowed on site, and thankfully in most sites they understand the seriousness of the situation, and they don't do that. Reduced collection days. Many of the sites have reduced the collection days. Reduces the chance of infection, and it reduces the number of employees required. So many of them have, like on the weekends, like you see here, decreased landfill hours and days of operations, no weekends. For many of them, sometimes it's only half day Saturday. So I just threw this slide in here that we won't talk about because you all will see it when you get the presentation. The Caribbean Water and Wastewater Association has worked with the IDB and several partner agencies to have a regional strategic action plan for the water sector in the Caribbean. And many of you guys will hear about this. We've started looking at the projects to be financed. So there is good news down the road for NRW, for a lot of projects that are required, climate resistant projects, renewable energy projects that will be coming down the pipe. So I want to thank you. My time is up here. These are the ways you can contact us. That's our website there, CWWA.net. Our Instagram. We are on all the social medias, but one of our hot ones is on Instagram, CWWA Caribbean. It's the same for Facebook. And of course, our Gmail is CWWATT, that's Trinidad and Tobago, CWWATT secretariat at gmail.com. Myself and Anuradha Maharaj and Jagdeep will receive your emails and any questions that you may have. So we're looking forward to working more with everybody. We consider 60% of what we do at CWWA is advocacy. So if you want to know who, what, when, where in the Caribbean in water, wastewater, and waste, give us a call, send us an email, and we will help. Thank you very much.